Good evening and welcome to the show you've all been waiting for. The grand finale of Healthcare Hell. The reality show that pushes healthcare professionals past their limits in situations that defy common sense, compassion, and human endurance. Behind me, our four finalists. Nancy from Saint-Julie, single mom and licensed practical nurse. Monique from Pontvillot, a single perfusionist. Jerome from Saint-Jérôme, respiratory therapist and father of three. And Natalie from Hahensick, nurse, married, and no kids. Let's give it up for Nancy, Monique, Jerome, and Natalie. Tonight, only one will survive, and the other three get crushed. And now, a final recap of our last week ordeals for our four healthcare pros. Nancy in the surgery department, over 30 dressings changed, 16 post-op patients to monitor, 20 patients to prep for surgery, 5 falls, 83 doses of medication to administer, 19 pages of paperwork and charts to fill out, and 3 hours of overtime that she'll have to fight to get paid for. Monique, 10 cardiac surgery, each lasting a minimum of 5 hours, including a triple bypass, an aortic dissection, a mitral valve replacement, a heart transplant, administering anticoagulant, working with 2 patients about to receive mechanical hearts, administering crystalloid cardioplegic solutions, and 1 missed birthday dinner. Hers. Plus 30 pages of reports complete. Jerome from Saint-Jérôme, 3 emergency intubation, 9 sprints from one end of the hospital to the other, 37 metric dose inhalers given, 6 patients treated in intensive care, 8 asthma attacks, 2 days without a break and 1 without a lunch, 3 children who don't understand why daddy's never home, and 1 frustrated spouse. Natalie on the medical department, 5 families to reassure, 8 patients to move, 33 intravenous doses to give, 25 calls in the intercom, 5 calls to the physician for telephone orders, 2 kilometers to run, 3 panic attacks to suit, 2 days of work with 1 less nurse on the team, 8 therapeutic nursing plans, 1 problem with the pharmacy, and I think that's enough. Don't go away. After the break, the final elimination.
Sadly, the reality of working in today's healthcare environment often far exceeds fiction. The unrelenting pressure our healthcare professionals are subjected to on a daily basis without the slightest concern for their physical or mental well-being puts everyone at risk. For us at the FIC, it's imperative we change the rules of the game by fighting for working conditions on a human scale for our members, so that they can give professional care as only they can.